You know, right now, many are discussing the affordable health care. It's our first guest. Well, they want dental care to also be a part of that conversation. And the good news, since 1986, Colorado has supported an alternative model to preventative dental care. In our state, hygienists can practice independently from dentists, allowing more people affordable access to dental hygiene care. So we are so excited to welcome to the show Angie Rhodes. We also have Cheryl Redmond and Vicki Flint, and they're here representing MyTeethCleaned.com. And if you watch the show, I was informing the ladies, I absolutely love going to the dentist and seeing my hygienist and getting my teeth cleaned. And so when I heard of this, I was really fascinated. So Angie, explain a little bit more about MyTeethCleaned.com. Such a great idea. So what's this all about?
We've created a website where a group of like-minded dental hygienists who own their own practice have come together and just made a directory so people can go and find a hygienist that wants to focus on oral health care prevention.
Which we're saying the Affordable Health Care Act, I mean, that's something that it's expensive, but this is where you can maintain your health. Your mouth is so important, and come and get those teeth cleaned. So what can a hygienist practicing independently, I'm thinking, what can you really do? Most people think, gosh, a dentist has to be there.
In Colorado, when you go see your dentist, the hygienist is the one who's going to take your radiographs, place sealants, do gum therapy, check for gum disease, oral cancer screenings, and actually the hygienist is the first person who goes through and checks for cavities. We can do that independently as well. It is within the scope of our practice.
And your hygienist is so important. They are the first person that looks in your mouth. How are you doing? Anything hurt? So then I'm thinking, well, I don't have to go to a dentist though, right? So
Right.
Why would you choose this way?
The model is a little bit different and gives you a lot of flexibility. So a lot of times what happens is people, they either have a fear of the dentist. When you come to see a hygienist, you're not going to get the sounds or the smell, so it's a little bit more relaxing and welcoming. Also, it's less expensive. We're not selling restorative dentistry, which doesn't mean we ignore it.
Right.
We all work with a network of dentists, so if something comes up, we definitely recommend that you see your dentist, and you should actually see a dentist annually for an exam anyway.
Of course.
But it just opens up the door, so you have a lot more options. You can go see someone where it's going to be more time efficient, more affordable, and our flexibility in our schedules is a lot. We're not 8 to 5. We like to work around our patients.
Yeah, it sounds like it's really a one-on-one type of situation, which is wonderful, and that's hard to find anywhere in the medical world. Cheryl, who would you say your patient is? Is it somebody like me?
Somebody like you, somebody like us,
Right.
somebody like the viewers. We see a typical patient that hasn't been into the office for quite some time. They feel intimidated, or maybe they're dental phobic. They just don't like going to a dentist. So we start with their health care as far as their mouth, their gums, and we make sure the foundation is healthy before we refer them out to a dentist. And the nice thing is we have some autonomy. So we, like Angie said, we have a network of dentists that we work with, and we try to fit somebody that fits that patient's needs. We also see a lot of busy people. We don't schedule 2 or 3 patients at an hour. So when our patient comes in, they're seated, they get their work done, we're done, and we send them on their way. We also see people from other communities. I actually saw a patient recently from Switzerland. She contacted me through my website. So people that maybe they're snowbirds and they're in Arizona and they have a dentist here, not there, they just want to come in and keep their mouth healthy, so we'll see clients of that nature as well.
Since I've known about the three of you, I could be in a lot more. Just in between all my regular, this every 6 months is what the usual is, I guess, for the cleaning. Cheryl, the emphasis, I like this too, because it is on educating people. It's not a scary place to come see you or even a dentist. And you have a YouTube video that discusses the ways that we actually can take care of our teeth. It starts at home. So take us through that a little bit.
I recently had a YouTube video made for my website. It's called The F Word. And I teach the client all the other implements besides dental floss, because so many people don't like to floss. And I actually have this on YouTube and on my website, but it gives several different implements that people can use so they find what they like or what makes it easy to help them to clean between their teeth. I do a lot of education with my clients, especially my first-time clients, because if I could teach them how to take care of themselves at home, I know when they come back, their gums will be healthier, and that helps their overall health.
Exactly. Vicki, I like that MyTeethCleaned.com, it's super, super easy to navigate. You guys, you haven't missed a beat. Explain what we can find actually on that site.
Great. So first there is a tab that there's a focus on you for sure. There's a tab also that says,
I want my teeth cleaned. I can see that there.
uh-huh,
About.
we clean teeth. That tells what we do. Find a hygienist. You can find a hygienist in your area.
And that's so important because, like you said, if you're in different areas, you can help with that as well. And even I see here for your health, because it's so much about your health.
It is so much about your health. Now, this is a new evolving website. We'll be adding more information all the time, educational articles and videos. We find there is no one perfect tooth, so we want people to be educated about all their teeth.
Exactly. But can I just get my teeth cleaned? That's solely what you do, correct? Or
So that's kind of a funny thing because that is the number one question that we get. If I'm talking to people, I understand that they're thinking a lot of times that I'm just going to come in, you're going to put the chair back, scrape, polish, and send me on my way. That's it. But we are professionals. That would actually be irresponsible for us to do that. We do oral cancer screenings, gum disease exams, cavity checks. We determine what kind of cleaning is best suited for your individual mouth, what it's going to take to get it done, and what it will cost.
of course. Now, Cheryl, what about insurance?
The insurance depends on the company. So we always recommend to the client that they need to call their insurance carrier and make sure that they'll cover the services at our offices. Some insurance companies will pay the client directly. Some will pay the dental hygienist. It just really depends. So it's best that the client check with their
Checks
insurance
first.
company.
Yeah. Now, for all three of you, because you're such beautiful, shiny, pearly white, what do you think sets you apart from maybe other places, especially being a part of MyTeethClean.com? What would you say is your favorite?
I'd say being able to control my schedule. I'm not being told that I'm not doing enough of this procedure or that procedure. I'm doing what the patient needs, and I'm taking the time that the patient needs. If the patient needs an hour, I give them an hour. If the patient can be in and out in half an hour, they're in and out in half
That's
an hour.
great.
It's not dictated by the schedule. It's
Looking
dictated
at the
by
watch and
yeah,
what's in the computer.
it's about the patient.
It is. What about you?
I have a very flexible schedule. I see a lot of my clients after work, so I do a lot of 6 and 7 o'clock clients. Sometimes I see clients on the weekends, so it depends on what the client needs. I can work around their schedule.
And what would you say the best part is about this?
The best part is being able to focus on what my clients like and also what I'm passionate about. I work a lot with alternative medical providers, and I'm very big on the oral systemic connection. I speak their language. I know patients that are also seeing acupuncturists and chiropractors. I can help coordinate their care and talk to them about what's going on in their mouth and how it's affecting the rest of their body and what those other practitioners are trying to bring into balance.
Oh, interesting. Yeah, your mouth. It's so important. It's where it all starts. Well, thank you, ladies. We hope to see you again.
Thank
Yeah,
you.
this is
Thanks for having
wonderful.
us.
Making dental hygiene care affordable is what MyTeethClean.com is all about. Go online and search for an independent hygienist near you and learn more about all the cost-saving services they offer. MyTeethClean.com also offers helpful information, including answers to your most frequently asked questions. You can also reach them by phone. Here's that number, 970-203-5332. If you feel dental hygiene care is out of your reach, time to think again. MyTeethClean.com is here for you always, and this segment was paid for by MyTeethClean.com. Dental hygiene with a focus on you.